Hello, and thanks for joining me today for this presentation on externally focused exercise, specifically the use of exergaming for whole body rehab of patients with joint hypermobility. The patient videos you'll see today are from our clinic in Bethesda, Maryland. As part of being a center for excellence, we see a high percentage of patients across the hypermobility and age spectrum. Because of that, we've been able to learn from our patients and develop a unique form of exercise training. The goal today will be to differentiate between internally focused exercise and externally focused exercise. Traditional physical therapy is often prescribed using internally focused cues. We'll talk about why externally focused may be more appropriate and more effective when dealing with pain and function. Most importantly, we'll talk about how patients can do this at home and how clinicians can use this in their office. Lastly, we'll bring it all together and talk about how exergaming, a form of externally focused exercise, can be used for whole body rehab. Here we see a patient playing one of our games in the office that we commonly prescribe for a form of whole body rehabilitation. Here we see some of the common goals of why exercise and physical therapy are prescribed. I think clinicians and patients would agree that as they reach a certain amount of strength, joint stability, and proprioception, they seem to do better during their day-to-day activities. The problem is, for many patients, physical therapy can be a painful experience and one that doesn't tend to increase function and decrease pain. We'll talk about why traditional exercise may fall flat for patients with joint hypermobility and why externally focused exercise may be an appropriate solution. Exercise can work for several reasons with respect to improving function and decreasing pain. We'll touch on a few and talk about why externally focused may be a better option than internally focused for these certain parameters. When done in the correct amount, exercise and movement are great ways to reduce systemic inflammation. The challenge is for these patients to start and stick with the program long enough to see the benefits. We found the motivational benefits of exergaming have helped patients enjoy and stay compliant with their exercise program. Feeling accomplished and good about oneself is a great side effect of exercise. Adding an objective component of keeping track of scores and milestones during exergame is another reason that it may be more effective than internally focused exercise. We'll come back to this as we compare and contrast the two throughout the presentation. Moving more efficiently and having different movement strategies is a key component of exercise therapy. In a moment, we'll see how virtual reality and exergaming offer unique experiences that oftentimes enhance movement strategies and help patients move more efficiently. In a state of chronic pain, it is very common for patients to have an overactive nervous system. Exposing patients to painful movements can be an important part of the rehab process. We'll see why exergaming may be the most effective strategy to do so. Exercise and strength training are critical to improvements in muscle physiology and ligament physiology. Here we see that in some patient populations, strength training can actually increase the thickness or hypertrophy of the ligaments. This is a soccer player in season, or ACL has grown in size. In our patients, we commonly see strength gains, and some of the improvements in symptoms may correlate with improved muscle size and possibly changes in the ligament structure as well. And finally, exercise has the great side effect of being able to dampen down pain signals or create descending inhibition. Unfortunately, in patients with chronic pain, they often have the opposite experience in which pain increases during their exercise. We'll talk about how exergaming may have the unique ability to avoid this problem and allow patients to use exercise as a pain management solution. Traditional exercise can still be useful. I use it in my clinic on a day-to-day basis. However, when we talk about self-efficacy, habituation, and descending inhibition, it's my opinion that exergaming or externally focused exercise is far superior. We'll highlight some patient cases and talk about why that may be as we go along. Before we get to those examples, we'll briefly talk about the difference between internal focus and external focus. An internal focus is one that is directed at the patient's own body and body movements. In this example, the cue to this patient would be keep their arms straight. The video I'll play next is the way that exercise is commonly prescribed.
So I want you to go against the wall. Have your hand just below shoulder height. Keep your elbows not locked out, but pretty straight the whole time. What you're going to do is you're going to press out as far as you can, and then squeeze those shoulder blades together. Now, if this one is feeling like, I got this.
For some patients, this may not be a problem, but for others with impaired proprioception or have difficulty learning new exercise or movements, it can oftentimes be frustrating and not that successful. In contrast, an external focus is directed at the effects that a patient's movement has on the environment. So in this example, the patient has been directed to knock out the lights. Here we see a patient doing that very task. Rather than asking him to keep his core tight or keep his shoulder blades down, I just simply asked him to knock out the lights. For him, it could be quite challenging or frustrating as a 7-year-old for me to continuously ask him to do things that either doesn't know how to do or is just not capable of doing. So by asking him to do something externally focused, we can get those same effects without leading to frustration. At this point, I don't want you to think I'm anti-traditional physical therapy or even all the time internally focused exercise. We'll talk about how traditional physical therapy models can still use externally focused cues. But more specifically, exergaming to me is a great alternative for whole body rehab and perhaps the best way to accomplish some of the tasks we talked about before in regards to pain management, descending inhibition, and avoiding some of these common pain experiences with physical therapy. Ultimately, I don't think it has to be either or. I use both on a day-to-day basis. It comes down to the patient's perspective, their preferences, and what their goals are with physical therapy. So how do we know that externally focused exercise even works? Truth be told, when we started this adventure, we had no idea that it did. We had a patient who we referred out for personal training to improve her strength related to joint hypermobility. When she came back to us several months later, she was doing incredible. Her strength gains were remarkable and her function was vastly improved. We asked her what she was doing and she had mentioned that she was exergaming. So we looked more into the research and we found out that there is an abundance of research demonstrating that externally focused exercise is superior than internally focused exercise. Gabrielle Wolf and her team have demonstrated time and time again that externally focused exercise is superior to internally focused exercise when looking at motor performance and motor learning. In this experiment, the simple cue of using your foot versus the plate made a significant difference in performance. The patients that used the externally focused cue, which was the outer part of the plate versus their foot, were able to demonstrate greater movements, balance, and performance. Not only did externally focused cues perform better during the intervention, but when measuring retention or motor learning several days later, they were able to demonstrate that that was vastly improved as well in those that used externally focused cues. Here, when measuring jump height, the simple instruction of thinking about the rung on the ladder versus their finger made a marked difference in how high the jumper went. As we expected, when focusing on an external focus, or in this case, the rung on the ladder, they were able to jump higher versus thinking about their finger. The same could be said about balance here. When focusing on one's feet, they did far worse than when focusing on the platform. Providing motivation or some form of control over what types of exercises patients do is equally as important as the attention of focus. The research tends to back that up as well. In this experiment, we saw the simple choice of what color your golf ball was made a difference on how successful you were with the performance. In this particular experiment, the choice was the color of the golf ball. In the clinic, oftentimes we ask patients which movements they prefer in relation to their goals, what types of activities they enjoy, and what they think will be the most effective thing for them to do while in physical therapy. While there's quite a bit of research demonstrating that externally focused cues are better than internally focused cues, there isn't really much there with respect to how patients who are in pain respond to externally focused exercise. So when we started using exergaming principles in the clinic, not only did we see great gains in strength and function in relation to whole body rehab, but patients were starting to break down barriers regarding painful movements. Most importantly, they weren't having these painful experiences with physical therapy that even we were running into before when using internally focused exercise. So my colleague Jan Damerholt and I revised the motor learning theory and added in some components that addressed what we were seeing with respect to pain science. To tell the full story of how exergaming can help with pain, we first must touch base on how we go about prescribing exergaming to patients that come into our clinic. First and foremost, exercises should be goal-oriented. In this case, the patient was rehabbing from a cervical injury that had a vestibular-ocular component. His goal was to return to high-level sporting activities, including tennis. Exercise should also be skill-appropriate. We want to make sure patients are not injuring themselves and are at the same time being appropriately challenged. A thorough evaluation can help us determine what skill level a patient may be at. Most importantly, exercise can be scaled from the very low level to the highest level in terms of professional athletes. Our goal as physical therapists is to determine where you're at and help you reach your goals. Where the previous exercise was very high level, here we see a low level exercise. This may be more suitable for someone who has cervical instability, severe dysautonomia, or one of the other comorbidities associated with Ehlers Danlos Syndrome. While our clinic offers unique technology and equipment for exergaming, there are many types of activities that can be done at your home that require very little equipment. I occasionally see patients at their house, and we may engage in externally focused exercise using some of the very pieces of equipment you see on this slide. This patient is challenging her balance by using a picture and reaching out and touching predetermined objects. While it sounds quite simple, when comparing her balance in the two environments, she did much better when having her focus on the picture and point out specific items listed. While the previous example using a picture may be quite low-tech, here we see using virtual reality as a high-tech option. In this specific example, the patient is recovering from a cervical fusion to address cervical instability, and she is using virtual reality to improve her cervical endurance, proprioception, and vestibular ocular coordination. While that was a higher level type activity, we can still use technology for low level type activities. This is a force sensor that we oftentimes use for when prescribing isometrics. Isometrics can be a great place to start for someone who may be lower level in their rehab, but it can still be effective and used externally focused. So rather than have patients just push into a wall or push into a ball, we can engage them in some type of game or activity. Ultimately, we want patients to improve their function. Many patients that come to our office have given up on activities they love doing and started to reduce their movements in their day-to-day life. Our goal is to gradually reintroduce those activities. This patient was having difficulty stocking items at her job that required her arms to be overhead. So we, in time, worked on gradual progressive loading over her head. And in this particular environment, she is using motion tracking and playing a game while working on strengthening. Some of you may look at that previous exercise and think that it's totally contraindicated for someone who has an hypermobile shoulder. That being said, it really depends on what the patient's goals are and what their individual situation is like. So for some patients, that might not be possible for them to do that. For others, it may be a fact of their reality that they'll have to get back to being able to use their arms in some form or fashion that require them to go above their head. Furthermore, it's not always controllable. So if they're at work, they're not going to be able to get in perfect form and focus on where their shoulder is all the time. So if we can gradually train patients to be in a more uncontrollable environment, I see it as a plus. Ultimately, I don't think we need to avoid these situations when we're getting closer to full extension at joints. We need to just gradually prepare patients to be in those positions. As we mentioned before, it's just a fact of many patients' reality that given their circumstances at work or as a caregiver, they're going to be in positions where their joints are challenged. Let's switch gears for a moment, and we'll come back to why exergaming can be an effective strategy for those who have had previous painful experiences with physical therapy or particular movements. This is not my graphic, but I thought it perfectly encapsulated how patients who come into our clinic are oftentimes stuck in a cycle of physical and emotional pain. Irony being that exercise and movement can be one of the greatest ways to get out of it. As we mentioned before, the initial entry point is oftentimes the most difficult part. The fear of movement, or kinesiophobia, is a high comorbidity of patients who have joint hypermobility. A very big reason for this is previous injury while exercising. Patients who have injured themselves previously with exercise are going to be on very high alert when starting a new exercise program. As a result, their brain may perceive and experience exercise as a painful experience. The low-hanging fruit here is that these patients need to move to improve. Our goal is to find a strategy that can ultimately distract them or disrupt their nervous system to not having these painful experiences and having some success with exercise. Exergaming allows these patients to get these small wins that over time add up to great success. In the previous video, that patient wasn't thinking at all about her back, she was just worrying about knocking out the lights. The irony being that many times patients come into the clinic, they're able to do far more when we put them in an exergaming environment than what they would traditionally do if we tried to prescribe internally focused exercise. The common saying is that neurons that wire together fire together. Many of these patients that have chronic pain and central sensitization are associating exercise with pain. By putting them in an externally focused environment or using exergaming, they can avoid these pathways and subsequently have success with exercise. This patient came into the clinic with a great fear of bending due to previous back pain and injury. Once we evaluated her and ensured her that it was in fact safe to start bending her back, we encouraged her to do so through the use of externally focused exercise. Here we can see in these two videos, again, she's not focused on engaging her core or how much her back may be hurting with bending. She's just having fun and knocking out some lights or using the weighted ball to go ahead and throw into the circular containers. So not only is it challenging, it's functional, and it's starting to work on some of these barriers that she's having in regards to bending her back. And again, the irony being that many of these patients are able to do far more with less perception of pain and difficulty when in an externally focused environment. In the previous video, I had asked Lucy to bend over and touch her toes when I evaluated her. And there was severe pain, guarding, and difficulty. After a few weeks of whole body training, it was something that she wasn't thinking about. And a part of that was getting stronger. Part of that was starting to work on fear avoidance. And then a big part was just whole body rehabilitation. Many patients that have joint hypermobility, it's not isolated to just one joint. So when we have rehab sessions, we can focus on several areas while using exergaming. In this video, she's working on hip core stability, some ankle stability, many things in the lower half as she works on knocking these lights out with some resistance from the cable column. And this patient can be seen doing the same thing, working on various body parts while using the external focus cue of knocking out or touching certain colors of tape as she goes. Here's another whole body exercise. The patient is rowing a kayak down the river using a cable column. And not once is she thinking about using her postural muscles, but she is using them quite a bit to do this exercise. Is there still a role for internally focused exercise? Well, ultimately, I think yes. Some of it may come down to the patient's preference. If there's an isolated impairment, and specifically maybe at a high level performance or intensity of an exercise. But for most patients, when we're talking about whole body rehab, I do believe that exergaming and externally focused tasks are the way to go. Ultimately, for any exercise program to be successful, the clinician needs to listen to the patient. They need to figure out what their goals are, what their current functional level is, and do a thorough evaluation to determine what their capacity is. As physical therapists, we often have to think outside the box. We need to search for ways that patients can be successful with movement rather than feeding into these same cycles that have not yielded great results. We need to be creative and engaging with these patients, and part of that can be using exergaming and externally focused exercise. When patients start to see success, that can build on future success. It only starts with one activity, one exercise to really break down barriers, to start allow patients to then further engage in more activities of day-to-day life. At the end of the day, exercise is just a component of management of patients with joint hypermobility. We've seen such promising results with using this approach that we can only hope that other clinicians start to integrate externally focused exercise, exergaming tools into their clinic as well. Thank you for your time and attention today.